They have the ability to replace damaged cells and even treat diseases. I'm talking about stem cells. And Dr. Kevin Kaplan is part of the surgical team at Jacksonville Orthopaedic Institute. Welcome back to the show, man.
It's good to be back.
That's right. It's a fun year right now for your other gig, helping the Jaguars as well. But what we're talking about today is stem cells, and because some of these athletes you're working with are asking to use these more and more. So let's start at the basics. Like, what are stem cells?
So stem cells are your body's natural ability to heal itself. We know if you, let's say, get a cut when you're shaving, you shaved off that mustache, which we all miss now, but if you cut yourself, it's not like you continue to bleed. Your body wants to heal itself.
Right.
So orthobiologics, which is the newest phrase in my profession, is a way to harness the body's own ability to heal. We can take cells out of your body, platelets, stem cells, and we can put them into areas where you have an injury and get those injuries to heal quicker.
Well, and the technology is advancing, year to year, and so are the indications to use it, those are also broadening and increasing for you?
Yeah, we're really, and I tell patients this all the time, we're the tip of the iceberg when it comes to this technology. We used to take a amount of blood, we'd spin it down, we'd get a certain amount of what we called the yellow plasma and inject it. Now with these newer technologies, this is a much more sophisticated way to do it. We can actually dial up the amount of growth factors, the amount of stem cells we need for certain injuries, whether it's an arthritic joint or an arthritic knee or just a tendonitis in the elbow, like a tennis elbow, we can change what we're using for certain injuries. So it's an amazing technology. We've been able to kind of tailor to every patient what we want.
So you basically have like different kinds of stem cells, like these are for joint pain, these stem cells are for muscle healing. How are they?
That's the amazing part about the body. A stem cell is the basic cell. It's the undifferentiated cell. We all have them. When we're born, we have them. And those cells, the body will send them to different places, and they can become any cell in the body. So if we use a certain cell type and a certain cell amount and put it into a knee, then those cells can become cartilage. If we put it into a tendon, those cells can become tendon. So it's the amounts that we use and how we use them that the body can then differentiate and say, this is a tendon, this is a joint, this is a piece of cartilage. So it's amazing what the body can do.
It's fascinating. It's fascinating. So let's get into a little bit of this machine, obviously, and also how do you get the stem cells from the body? And
so a lot of people are nervous when you say, I'm going to harvest stem cells. It's a relatively simple, safe procedure. I do it in the office. We use special needles to harvest the stem cells from the pelvis. You can also get stem cells from the fat. A lot of the studies are showing that the ones from the bone marrow that we actually get are a lot better and a lot more effective. Then we can put them into this machine and we can actually spin down those spin down the cells and the blood and get the actual PRP, the platelets and the stem cells, and then inject it into the body.
Yeah, it's fascinating. This looks like the centrifuge that I used to use in chemistry when you're trying to separate all the stuff. And so basically just go in here, stem cells, and then you're injecting them after you get them from there, you're injecting them into the different part of the body, the injury?
Right. So when you look at this machine, it actually uses wavelengths of light to separate out the components. The red blood cells, this is how we get our oxygen to our body. We don't really need to inject those, so we can separate that out. This machine can detect the wavelengths of light and get the red blood cells out. And then the actual stem cells and the platelets come into this syringe. So we get it sterilely, and then under sterile conditions and using ultrasound, I can actually really target where I want to put those cells to get a healing response.
This is amazing. It's like it's sci-fi.
It's almost like Star Trek.
It is. It looks like the movies you watch. Like, here's the healing stuff. So after you get this injection, this is not super juiced and suddenly you're fine, but what's the process? Is your body
so there's a rehabilitation process. I always tell patients your max benefit that you're going to get from stem cells is between 8 to 12 weeks. So I have a rehabilitation protocol for every different injury and every different body part. And I've been amazed with the results. I've had patients come in and say, I'm 80% better, I'm 90% better, I'm 60% better. I've never had someone come in and say, well, that didn't make a difference, or that made me worse. So the results are fantastic. I actually have a shoulder injury myself, and I'm just, maybe you can help me out, and I can teach you, and you can do my shoulder. But it's amazing technology to keep patients out of the operating room, and it's another conservative option that we have rather than going to surgery.
And one of the things that, like I said, you're using it with the guys over at the Jaguars there. They're asking for it. Professional athletes are asking for it. But everybody out there watching this is for everybody. This is something all of us can do, right?
It is. Professional athletes use it because they want to stay on the field. It's not illegal to use this stuff. It's their own body's ability to heal. And weekend warriors love it because you don't have to miss time from work. You don't have to miss time from the CrossFit gym or whatever you're working on. And patients seem to love it.
It's good stuff. Good stuff. Appreciate you being here.
Thanks for having me.
We want to thank Jacksonville Orthopaedic Institute for making this segment possible. And for more information, you can log on to their website, which is joi.net, or you can reach out to Dr. Kaplan directly. His website is kevinkaplanmd.com. You can also call their mainline number at 904-JOI-2000.